The day has finally arrived. Former Gauteng Health MEC Qedani Mahlangu testified on Monday at the eseTheMeni arbitration hearings in Gauteng. She apologized to the families for the deaths of their loved ones, saying she sincerely is sorry about the decision.
I, Qedani Mahlangu, hereby state that the loss of life our country experienced following the termination of life eseTheMeni service level agreement is certainly one of the most painful ever incidents in the history of the South African health system. The deaths of approximately 140 mental health care users is indeed painful and regrettable. And I want to upfront express my sincere condolences to the families who lost their loved ones following the termination of the life eseTheMeni service level agreement, including the removal of the mental health patients from life eseTheMeni healthcare facilities. Our healthcare system is meant to preserve and work humanly possible to prolong human life. In this regard, our primary role as the Department of Health then in the transfer of patients from life eseTheMeni was to ensure that we deliver service to all the people of Gauteng. Clearly this did not go according to plan. And for that I sincerely apologize. It did not go according to plan, and it is indeed very unfortunate and deeply regrettable that the implementation of this project ended up with a tragic loss of life. And I am really sorry that innocent and vulnerable members of our society lost their loved one in that process.
She did, however, also say that the decision to terminate the contract with the life eseTheMeni group was not hers alone, but a collective decision by the Gauteng provincial government. She also says the department's former head, Dr. Qedani Mahlangu, and the former director of mental health services in the province, Dr. were the ones who took executive decisions. She says she trusted them because they are doctors and have worked in the health department for many years.
I work with professionals now, very qualified people, as far as I'm concerned, and I have no doubt that the team of people I work with are well qualified, well suitable, and they've been in the system longer. So they know their responsibilities and duties, and I was comfortable that they know what they're doing and because they are professional.
Former Health MEC says she resigned from her position because she thought this was sufficient in her taking account for what happened. 143 mentally ill people died as a result of the termination of the contract. Mahlangu says she doesn't accept the findings that were made against her by the Health Ombudsman in his damning report that was released on the 1st of February 2017. She resigned on the eve of this report being released. Eyewitness News, Johannesburg.